Hey there. Welcome to All Things Social Security. I'm Stephanie Joy. Whether you are a first-time viewer, an occasional viewer, a subscriber, or one of the three tiered benefactor members, I want to welcome you and let your video begin. Remember, if you haven't checked out the memberships, it might be something up your alley because it gives you an opportunity for a little more Social Security disability attorney attention if you need it, but don't have representation and don't want to do a full-fledged consultation. Okay, have a great one, guys. Stay tuned. Hey, so you know how I'm always talking about the importance of keeping your credits going, even if you're not able to work full time, it can be so valuable. I have a pure example today, and I'm very excited. Young person, severe mental conditions. It's very sad. A lot of inpatient treatment and things like that. In any event, this young person has, since say the age of 18, worked short term, like maybe 3 months was the most the person could muster before extreme anxiety and panic attack had her walk out of every job and or get fired. 3 months, 3 months, 3 months. Okay, so all of that is considered probably unsuccessful work attempts. Of course, if they conjoin, close in time, like just a few weeks gap with that and another job, and the combined two are over 6 months, it would probably be considered sustained work activity. So, but nonetheless, the concern was this person is going to be stuck on SSI because they've been disabled and not able to hold down a job. Now, there is a DLI concern, but that's another story. This past year, this person worked 1 week at one job, 1 month at another job, and 3 months, I want to say, at a third job. So when you look at it all, it's like 4.5 months worth of work, maybe. And she earned like $7,900. Now, this hasn't shown up in her earnings statement yet because it's 2024. But prior to seeing that and learning that, the DLI was June 30th of 2024. So the little work she had done before had gotten her Social Security disability insured, but it expired, at least at the time that the SSA figured it out more recently, as of June of 2024. However, and there was no work at all in 2023. That was a lot of hospitalizations. But the 2024 work, and I did the calculations, are going to give her 4 credits, and she's going to be back in insured status so that when we do her case, she's not just relegated to SSI because of that little sporadic work and making 7,900, because I think right now it's a little over 7,000 you have to make for all 4 credits. She's now in insured status for a little bit longer, and that might be enough. And remember, the reason why it's important to be in insured status when you're claiming disability is because you can't get Social Security disability unless you can prove through medical records that you were legally disabled under their definitions during the time period you were insured, so before it expired. So while hers did expire on the books, that's because SSA didn't have her 2024 earnings that she was earning around the time that they figured without that before, because remember, 2024 hasn't been reported yet. But it will be very soon. And I think it's going to push her out maybe to middle of 2025. And we're just getting the application out now. So it's a dual application, SSI and SSD. And I'm trying to prove an onset date of a couple years ago when she was still under the age of 2022. That way, she would be eligible for DAC should she remain disabled and one day her parents collect. Mom, gets retirement, and her parents would clearly be probably having a far more robust work record than she. And she will be ultimately eligible for a record under their work record if it's bigger than her own, which it probably will be. Like as I'm looking at it now, all right, she's going to be hopefully eligible for SSD now because of this few months in 2024 where she worked and got these credits, even though all the work was a failure, it didn't fail in that, you know? So that's what I always say, gosh, if you can just get out there and do a little bit of work, it could be spread out all year round where you're just working a very little all year round, or it can be in bursts like she did. Either way, it doesn't matter as long as it's tax paying work, right? So I was really thrilled about that because I'm always trying to get people to not have to be on SSI forever and have their own work record, because I just think it's a far better place to be in terms of your independence and, you know, not having that knee on the back of your neck with regard to any kind of income that comes your way, including inheritance. If we can pull this off, rightfully so, she would be able to inherit from her parents one day, be able to, whether earn work record, get married if she chose to without losing SSI, because it wouldn't be SSI. If she's on DAC, there's a limit there to the marriage, but that's a whole nother thing. But anyway, and she'll get Medicare instead of being stuck on Medicaid. And I think that's always a good thing. So, and in the future, if she is on the benefit and she wants to try these sporadic work attempts, we'd have to have a little discussion about SGA and trial work period. But in a part-time capacity that maybe won't stress her out so much that she decompensates, then that would be another thing where she can keep the income she earns while collecting her Social Security disability. You can't do that the same way with SSI. And it would also, because she's earning and paying more, you know, paying those taxes on that earnings, her own Social Security disability and retirement benefit is going to incrementally go up as well. So there's a win-win-win-win-win for all of this. Anyway, so when we say a little bit of work can really keep you in that insured status, this is a prime example, and it could make a big difference for a young person for the rest of her life. So I'm really thrilled about it. All right, I will talk to you guys later, but that's what I wanted to share with you about that little part-time work, those little unsuccessful works that everyone's so unhappy about. They do pull off something really good for you, and that can be that insured status and those credits. It can also, remember, you need credits to get retirement one day too, not just disability. So you need those, you know, ultimately 40 credits. So anyway, that's a step in the right direction. I'll talk to you guys later. Bye. Hey, so if the subject matter of the video you just listened to is of interest and you want more on it, stay tuned. Here's another one about the same topic, but a little bit different. Bye now. Hi. The decision to make a Social Security disability claim can be really a tough one for a lot of people because they have to pay their bills while it's pending. It can be particularly difficult for somebody who doesn't have a partner who shares and can take over expenses entirely. So oftentimes people keep working longer than they really should for their health reasons. And other times they just absolutely can't survive unless they have other income coming in, such as from a part-time job. So as you probably know from the other videos, the SSA does allow for you to work somewhat while having a pending claim. There are strict rules, and I would definitely urge you to speak to your attorney or your non-attorney representative if you are going to work part-time. And there's a couple things. I mean, aside from the blatant bar from a black and white perspective of a financial amount, which in 2023 is $1,470 per month, would be SGA. So you cannot hit SGA, and that is gross before taxes. But I always tell my clients, don't flirt with the line. Don't dance around. There's two things. Don't dance around it, because inadvertently, it happens very often that someone tips over it. Secondly, by even coming close to that line, while it won't be a bar based on the numbers, if you're not really robustly treating like your attorney is going to be nagging you to do if they're doing their job, like I am, aka the nag hag, you run the risk of kind of putting in even more of scrutiny on the fact that you don't have maybe the most robust medical treatment. I mean, your work schedule is part-time, so you certainly have time to go to the doctors and physical therapy and all those things you might need to do. And if you're not doing them, the fact that you are, not making SGA, but you are within, a stone's throw away, could really give some suspicious thoughts in the mind of a decision maker, that you're not necessarily as disabled as you claim to be. So first and foremost, obviously the medical records are what you're going to be pursuing as your full-time job, regardless if you have a part-time job. You've got to, you just have to. And that would be for, as the other videos explain, every impairment, big and small. So you really have to make that your top job. But aside from that, you're going to want to take the jobs that, or the style in which you take a job. You might want that to reflect better. Look, if you're pushing through an 8-hour day twice a week at 16 hours and you're under SGA, you are under SGA, so the bar is there, and you're not breaching it, but you're pulling out an 8-hour day. If that's really crushing you, I strongly would suggest you consider maybe having 3 days of shorter shifts, because the representation that you can work an 8-hour day, even though you're only doing it twice a week, we've got suspicious minds looking at it. They have a job to do. It's protecting the fund partially, right? And so every little thing, attendance circumstances can matter, even though you really couldn't do 8 hours a day, 5 days a week, and are actually disabled. But the longer shifts are maybe not the most favorable way to make your earnings. I would also suggest, along with the shorter shifts, which probably your health needs are begging you for anyway, alternating days, maybe not having, if 4 or 5 hour shift day really makes it hard to do it the next day, but you're doing it because that's the schedule they gave you, and it doesn't feel good, and day 2 is worse than day 1. The day 1 5 hours not being followed up by a day of rest might be too much. And if it is, you kind of want that to be revealed. You're kind of covering it up by continuing to do it. So you might want to consider changing your shift, having them gapped out, with a nice break in between, so that when you do feel like crap the next day, you are not back on the job as if nothing happened. And, of course, being on the job, it's going to appear like you're just fine when you're actually not. So, use your noodle when it comes to what kind of job you're going to do and what kind of schedule you're going to have, because I think the scheduling can be very important. Okay. All right. Enough for that. Talk to you later.